Do you know that the NHS waiting list still tops 5.2 million patients, with an average wait of 18 weeks for elective surgery? On November 24, 2025, the Chancellor announced a sweeping reform designed to cut those figures in half and roll out new neighbourhood health centres across England. The plan will see the NHS move from a centre-heavy model to one that prioritises community-based care, bringing diagnostics, treatment and GP services closer to where people live. This announcement comes as part of the government's larger devolution, integration, prevention agenda, aiming to make the NHS faster, fairer and more resilient. All this comes as the NHS faces increasing pressure from an aging population and rising demand. The Chancellor's pledge builds on the March 2026 Institute for Government review that questioned whether the current devolution, integration, prevention strategy was cohesive. Since that review, the government has tightened its focus, announcing a dedicated £3 billion budget for the new health centres and a £2 billion investment in diagnostic technology under the CDC programme. This follows the July 2025 Life Sciences Sector Plan, which earmarked £10 billion for NHS-linked research and innovation. Together, these moves signal a shift from reactive hospital care to proactive, community-anchored services that reduce the need for costly referrals and shorten waiting lists. These commitments also include a phased rollout of primary care hubs in every major city by 2028, ensuring local access. Today, the first 30 of the new neighbourhood health centres have opened in London, Birmingham and Manchester, each staffed with a GP, a nurse practitioner and a diagnostic suite. Early reports show a 12% drop in GP waiting lists in those catchment areas, while patients in Leicester noted a 4-week reduction in the average time to a specialist referral. At the national level, the CDC program's rollout to 160 sites has already saved over 25,000 diagnostic appointments, freeing up hospital beds for urgent cases. These early wins demonstrate that bringing care closer to home can directly translate into faster, cheaper treatment pathways and improve patient satisfaction scores across the board. Looking ahead, the government has mapped a 5-year timeline. By 2028, all 200 planned neighbourhood health centres should be operational, with integrated digital records linking primary and secondary care. The NHS long-term plan predicts that this network will cut elective surgery waiting times from 18 weeks to 12 weeks by 2029, while the CDC programme aims to double the number of rapid diagnostic tests available by 2027. Independent experts say that if these targets are met, the NHS could save an estimated £5 billion annually in avoided hospital admissions. The real test will be whether the rollout keeps pace with the 1 million patient waiting list that still looms by maintaining continuous funding and workforce training. In short, the Chancellor's latest NHS overhaul is more than rhetoric, it's a concrete plan to have waiting lists and bring care into the neighbourhood. With a clear 5-year rollout of health hubs, a surge in diagnostic capacity and a renewed focus on prevention, the UK is positioning itself to deliver faster, fairer treatment for millions. For patients, the change means shorter waits, quicker referrals, and more local choice. For policymakers, it offers a roadmap that balances cost savings with improved outcomes. The real story will unfold in the coming years, but today the evidence suggests that the NHS is on a decisive path toward a more resilient future and reduce the strain on emergency departments for patients and staff alike.